Mckenzie Cervical Spine Repeated Rotations. This is a good exercise for a lateral derangement or a lateral disc prolapse in the cervical spine. This type of problem can cause neck and shoulder pain. If the prolapse is severe, then the pain can also go down the arms. It comes from the Mckenzie assessment and treatment philosophy. Undertaking this exercise, you need to have been assessed by a physiotherapist who is Mckenzie trained, as doing this exercise with the wrong type of problem can make things worse. This exercise is all about post-exercise symptom relief, or what is known as centralisation, which is when symptoms move away from the periphery and closer to the midline of the neck. If your symptoms increase more peripherally after performing this exercise, then you must immediately cease the exercise and consult your physiotherapist. If you get any blurred or double vision, feeling sick, feeling dizzy, passing out, numbness in your tongue, or any problems with swallowing, then don't perform this exercise. Also, if you have any CAUDA EQUINAS symptoms, which include bladder and bowel incontinence, retention, urgency and saddle area numbness, then this exercise isn't right for you and you need to see a physio or doctor as soon as possible. If you're unsure, then don't perform this exercise until you've seen your physio or doctor. Ideally sitting in a chair, looking straight ahead, tuck your chin in very slightly by gliding your head backwards. Don't tip your head back or forwards. Maintain this position throughout the movements of the exercise. Next, rotate your neck to the painful side. Once you can't go any further, then return to the start position slowly by reversing the procedure. Perform 10 repetitions as far as you can on each repetition. It can bring on worse symptoms during, as long as afterwards the symptoms either lessen or centralise. The frequency that you do depends on whether your symptoms are above or below the elbow. For above the elbow, you should do 10 repetitions every 2 to 3 hours. For below the elbow, you should do 10 repetitions every hour. Once your symptoms have disappeared for 3 days in a row, then you can wean the frequency down slowly each day until you stop the exercise. Once recovered, you need to reduce the risk of reoccurrence, which you should speak to your physio about.